Hyperthyroidism is an endocrine disease. Look at this picture, shows that healthy normal thyroid gland. Hyperthyroidism, enlarged thyroid gland, and other metabolic systemic symptoms in brain, nervous system, cardiovascular, endocrine, etc. Detail going on. Introduction. Hyperthyroidism, also known as overactive thyroid, is a condition where the thyroid gland produces excessive amount of thyroid hormones, specifically triiodothyronine T3 and thyroxine T4. This leads to an acceleration of the body's metabolism, resulting in a range of symptoms and potential complications if left untreated. Definition. Hyperthyroidism is a condition where the thyroid gland produces excessive thyroid hormones, leading to symptoms like rapid heartbeat, weight loss, and anxiety. This overactive thyroid disturbs the body's metabolism, causing heightened energy, expenditure, and other symptomatic effects. Types. 1. Graves' disease, an autoimmune disorder where antibodies stimulate the thyroid gland to overproduce thyroid hormones. To toxic multinodular goiter, enlargement of the thyroid with multiple nodules that produce excess hormones. 3. Toxic adenoma, a single benign nodule that automatically secretes thyroid hormones. 4. Thyroiditis, inflammation of the thyroid gland that can release stored hormones into the bloodstream. 5. Subclinical hyperthyroidism, mild hyperthyroidism with minimal or no symptoms. Causes. 1. Autoimmune conditions such as Graves' disease, where the immune system attacks the thyroid gland. 2. Nodules, overactive thyroid nodules, adenomas can increase hormone production. 3. Excess iodine intake, high levels of iodine can lead to increased hormone synthesis. 4. Medications. Certain medications like Aminodurone contains iodine and can contribute to hyperthyroidism. 5. Pituitary disorders. Rare cases involve pituitary gland abnormalities that produce excess TSH leading to hyperthyroidism. Risk factors. 1. Family history. Genetics play a role, especially in autoimmune types like Graves' diseases. 2. Gender. Females are more susceptible than males. 3. Age. More common in people aged 20 to 40. 4. High iodine intake. Excess iodine in the diet or from supplements. 5. Smoking increases the risk of developing thyroid eye disease in Graves' disease. Complications. 1. Cardiovascular issues. Increased heart rate, arterial fibrillation and potential heart failure. 2. Osteoporosis due to bone mineral loss from prolonged high thyroid hormone levels. 3. Thyroid stone, a life-threatening acute exacerbation of hyperthyroidism symptoms. 4. Vision problems, particularly in Graves' disease, which can lead to bulging eyes. 5. Psychological effects, anxiety, irritability and mood swing. Pathophysiology. Hyperthyroidism results from a excess of T3 and T4 hormones, which affects almost every organ system in the body. Thyroid hormones are critical in regulating metabolism, heart rate and body temperature. Overproduction can overstimulate these functions, leading to the hypermetabolic state seen in hyperthyroidism. In autoimmune hyperthyroidism, example Graves' disease, the immune system produces thyroid stimulating immunoglobulins TSI that bind to TSH receptors, prompting excess thyroid hormone production. This disturbs the hypothalamic pituitary thyroid axis. Pathophysiology of hyperthyroidism, step-by-step process. 1. Hypothalamus signals in pituitary to pituitary release TSH. 3. Overactivity in the thyroid gland, potential trigers, autoimmune attack, toxic nodules, thyroiditis. 4. Excessive production of T3 and T4. 5. Increased metabolic activity in cells. 6. Hypermetabolic effects on organs and systems, including cardiovascular system, nervous system, gastrointestinal system, musculoskeletal system, thermoregulatory system. 7. Development of clinical symptoms. 8. Long-term effects and complications. The step-by-step process explains how hyperthyroidism disturbs normal metabolic functions, regulating in the wide-ranging symptoms and complications observed in affected patients. Signs and symptoms. 1. Cardiovascular: tachycardia, palpitations and hypertension. 2. Respiratory: shortness of breath and increased respiratory rate. 3. Neurological: tremors, anxiety and irritability. 4. Gastrointestinal: increased appetite, weight loss and diarrhea. 5. Dermatological: warm, moist skin, hair loss and in some cases Graves' dermopathy. 6. Reproductive: menstrual irregularities in women, reduced libido in men. 7. Other: heat intolerance, fatigue and muscle weakness. Diagnosis: 1. Thyroid function test measures levels of TSH, free T4 and T3. 2. Radioactive iodine uptake test determine thyroid activity. 2. Thyroid scan visualize the thyroid to identify nodules or inflammation. 3. Antibody test detects TSI or TSH receptor antibodies for Graves' diseases. Nursing diagnosis: 1. Risk for imbalanced nutrition related to increased metabolic rate. 2. Anxiety related to hypermetabolic symptoms. 3. Fatigue related to hyperactivity of the thyroid gland. 4. Risk for decreased cardiac output due to increased heart rate and possible arrhythmias. 5. Disturbed body image related to changes in physical appearance, example exophthalmos in Graves' disease. Management: first, medical management. 1. Medications: A. Anti-thyroid drugs, methimazole to reduce hormone production. B. Beta blockers such as propranolol to manage symptoms like tachycardia. 2. Radioactive iodine therapy destroys overactive thyroid tissue. 3. Surgery: thyroidectomy. in severe cases or when other treatments are ineffective. 5. Supportive care, monitoring cardiovascular and respiratory status. Nursing management. 1. Vital sign monitoring, regular access, heart rate, blood pressure and temperature. 2. Nutrition management, high calorie, high protein diet to addresses metabolic needs. 3. Patient education, educate about medication adherence, potential side effects and recognizing signs of complications. 4. Educational support, provide reassurance and support for anxiety and emotional liability. 5. Post-operative care for those undergoing thyroidectomy, monitor for hypocalcemia and airway obstruction. Treatment. 1. Antithyroid medications suppress hormone synthesis. 2. Radioactive iodine therapy, most common definitive treatment. 3. Surgical interventions, partial or complete thyroid removal. 4. Lifestyle modifications, stress reduction techniques and avoidance of excess iodine. Psychosocial medicine. Patient with hyperthyroidism may experience psychological challenges such as anxiety, mood swing and social withdrawal. Here are 5 psychosocial aspects commonly considered in managing hyperthyroidism. 1. Emotional and psychological support. 2. Body image and self-esteem. 3. Coping with social and occupational impact. 4. Education and empowerment. 5. Managing treatment related anxiety. Addressing these psychosocial aspects is essential in providing holistic care for patients with hyperthyroidism, as managing the mental and social effects can significantly improve overall treatment outcomes and quality of life. Prevention. 1. Routine screening, especially for those with family history or other risk factors. 2. Iodine management. Avoid excessive iodine intake, particularly in susceptible individuals. 3. Health education, awareness of early symptoms and promoting regular checkups. In conclusion, hyperthyroidism is a manageable but potentially life-threatening endocrine disorder. Through timely diagnosis, appropriate medical and nursing interventions, and supportive care, patients can achieve good outcomes and maintain a normal quality of life. Ongoing patient education and psychosocial support play a crucial role in managing this chronic condition effectively. Thank you. Have a nice day.